Hello, another clinical chemistry review video on enzyme, alkaline phosphatase, and GGT. So let's start with alkaline phosphatase. So physiology is it is a hydrolase that releases inorganic phosphate from its substrates. It is found on membranes and cell surfaces of cells of the small intestine, kidneys, liver, bone, and placenta. The clinical significance is it is part of the CMP, Comprehensive Metabolic Panel, and LFT, liver function test or hepatic function test, as it assesses liver activity. Increases in alkaline phosphatase activity are commonly seen in obstructive hepatobiliary diseases, which means liver diseases that will obstruct bile flow. So for that, you can think like gallstones or tumors and stuff that get in the way of the flow of bile. As well as in osteoblast-mediated diseases, so it's also related to bone and bone growth. The clinical significance continued. The reference range for infants and children are going to be higher than in adults due to elevated activity because of the growth process, because their bones are getting longer. And so that's common, and it's also elevated in pregnancy because it's found in the placenta and because, of course, babies are growing bones. The normal range for an average adult for alkaline phosphatase is 30 to 120. Of course, ranges do vary by analyzer and facilities. The high alkaline phosphatase are seen in bone diseases, osteomalacia, hyperparathyroidism, liver disease, biliary obstruction, and pregnancy. So how do we measure it? First, again, avoid hemolysis for alkaline phosphatase because it is found in red cells. There is a Bowers and McComb method. It's p-nitrophenyl phosphate reacts with alkaline phosphatase. I believe it's at the pH of 10. It makes p-nitrophenol, which is a yellow compound, whereas p-nitrophenyl phosphate is colorless, plus the phosphate ion that got released by alkaline phosphatase, and the yellow compound is measured at 4 or 5 nanometers, so the more activity of alkaline phosphatase, the higher that p-nitrophenol is going to be. There is a heat inactivation method, not widely used, also kind of not the best way, a little outdated, but sometimes those questions are on the boards. So the heat inactivation, the purpose was to distinguish alkaline phosphatase activity that comes from the liver or the bone. So, if it's high, what are you looking at? So alkaline phosphatase from the liver will remain after heating the sample, but the alkaline phosphatase from the bone will be destroyed by heat. All right, GGT or gamma-glutamyl transferase. Physiologically, it is a microsomal enzyme that is made in the biliary tract along with alkaline phosphatase. It is found on the cell surface and in the cytoplasm, and it catalyzes the transfer of a gamma-glutamyl from a peptide, and it is found, the GGT found in serum is primarily of hepatic origin. It is part of the detoxification pathways. The clinical significance of GGT is increased GGT levels are seen in the majority of liver disorders, with unusually high levels seen in patients with primary and metastatic hepatocellular carcinomas. More on the clinical significance, patient with alcoholic cirrhosis or chronic alcoholics will also display elevated GGT activity. Makes sense if GGT is part of the detox pathway and you're constantly putting toxins, which alcohol is a toxin in your body, that activity would be elevated because your body's constantly trying to detox that alcohol. And so it's been useful as a marker of alcohol use, especially for patients that might be in alcohol rehab and stuff, to check for relapses and stuff, because y'all know, patients don't always tell the truth. So that's one way GGT can be used in a lot of rehab clinics. It is high, obviously, in hepatobiliary diseases and biliary obstruction. So again, anything that messes with the biliary tract or flow of bile, stones, gallstones and stuff like that, or any kind of scarring or tumors or things that get in the way. Phenytoin and phenobarbital can increase it. So again, if it's part of the detoxification pathway, that wouldn't be surprising. And GGT is going to be normal in bone diseases. So that's another use that's a little bit easier than that heat inactivation procedure that I talked about for the alkaline phosphatase. So you can actually just run a GGT. Most big analyzers have this capacity, and if the GGT is normal, then you know that the elevated alkaline phosphatase would be of bone origin. The range for GGT is 2 to 30 international units per liter. And the lab method for GGT, it is, again, often measured when alkaline phosphatase activity is elevated and you're trying to ferret out where it's coming from. If the elevated alkaline phosphatase activity, again, is of hepatic origin, both GGT and alkaline phosphatase will be elevated. If the elevated alkaline phosphatase is from bone, the GGT will be normal. Again, there you go. That's a good use for it also. Hemolysis does not affect GGT levels, and the method by which it is measured uses gamma-glutamyl p-natural anilide with glycylglycine, and GGT will move the gamma-glutamyl group to the glycylglycine and leave the p-natural anilide that is actually by itself then a yellow color compound, and that can be measured at 405 to 420 nanometers. And that is it for your review. Thank you for watching.